The Office of Experiential Education at the St. Louis College of Pharmacy maintains a document entitled The General Guidelines for Experiential Education. The purpose of this document is to serve as a place for all policies to be kept that relate to student requirements and experiential courses. This document is updated throughout the year, and a copy can be found in the electronic preceptor manual for each rotation. Regarding student requirements, all students are required to possess and maintain a current valid Missouri Pharmacy Intern license throughout the professional experiential curriculum, regardless of where they are completing their rotation. Licensure requirements in other states may apply to students while on rotation, and it is the responsibility of the student to research that state's laws and report this information to the Office of Experiential Education. In addition, a copy of the appropriate license, if needed, should be given to the office at least 6 to 8 weeks prior to the start of the rotation in that state. While on rotation, students should carry a copy of their license. Requirements that are the responsibility of the student and regulated by the college are shown on your screen. All pharmacy practice experiences are completed at locations that are approved by the Office of Experiential Education. Students may not be placed on a rotation in the same pharmacy or department where they currently work or have worked in the past. This does not preclude a student from rotating within the same chain or health system if the rotation is in a separate department and with a separate supervisor. Students must report pharmacy-related employment and employment changes prior to the rotations. Students also may not be placed at a site where a close personal contact is employed in the pharmacy or has ownership of the pharmacy. Close personal contacts include immediate and extended family, spouses, significant others, or current or former roommates. It is the responsibility of the student to inform the Office of Experiential Education prior to or during a rotation if they become aware that a close personal contact is employed at the site. During the rotation, students will not receive financial or other considerations from the preceptor or site for services associated with the rotation. The hours requirements for each rotation type are shown on the screen. For the concentrated IPPE health system and community rotation, the students are required to complete a minimum of 40 hours per week for 3 weeks to total 120 contact hours. For each APPE rotation, students are required to complete 40 hours per week for 5 weeks at 8 practice sites. This will total 1,600 contact hours throughout the last year of their schooling. Throughout either of these rotations, students may not be granted more than 48 hours of intern credit each week per Missouri Board of Pharmacy regulations. Time missed due to absences, including excused absences, is subject to being made up. If the student is ill or has an emergency, the preceptor and the Office of Experiential Education must be contacted as early as possible on the day in question. Excused absences include and are limited to medical illness, personal or family emergencies, holidays, and professional meetings or seminars. Excused absences are not granted for primarily social, family, or work-related activities. Missed days not due to emergency or illness must be discussed with the preceptor and approved in advance. Legal holidays are considered off days for all pharmacy practice experiences and do not need to be made up. STLCOP's academic calendar for didactic classes does not always apply to pharmacy practice experience schedules. Each holiday noted counts as 8 hours towards a rotation required hours. Each college-sanctioned holiday counts as 8 hours towards a rotation's required hours. STLCOP recognizes the following legal holidays that fall within the rotation schedule: Martin Luther King Day, Memorial Day, Independence Day, Labor Day, Thanksgiving Day, Christmas Day, and New Year's Day. The Office of Experiential Education asks that students use extra caution when uploading documents to Core ELMS that no protected health information is included. If anything has been accidentally uploaded with protected health information, students should contact Michelle Mealy, the Experiential Coordinator, for assistance with deleting the files containing PHI. Students should pay special attention to protected health information in the form of patient initials and dates. For a full list of protected identifiers that cannot be used, please see the preceptor manual. The Family Educational Rights and Privacy Act of 1974, or FERPA, governs the release of student educational records maintained by an institution of higher education and access to student records. This includes, but is not limited to, requests from parents, guardians, spouses, or others that may wish to access this information. STLCOP's general policy to ensure student privacy is to not share or disclose any FERPA-protected information without a student's consent, indicating what information and to whom it may be shared. However, a student's FERPA-protected information may be disclosed to those STLCOP officials, such as, but not limited to, student advisors, preceptors, or certain faculty members possessing a legitimate educational need. In such cases, this information will be restricted exclusively to the information necessary for the STLCOP official to perform his or her duties. During the site approval process, the Office of Experiential Education will solicit information from preceptors regarding any potential safety concerns in the areas surrounding the rotation site. Student concerns regarding safety of experiential sites will be addressed, and if needed and deemed appropriate, accommodations will be made on an individual basis. The student and preceptor will review policies related to safety during site orientation. Additionally, students are expected to follow general safety principles while at the rotation site to minimize potential risk. Students who would like more information or who have a specific question about the best method to minimize risk should contact STLCOP's security officer. In the event of an emergency, the student will follow the emergency preparedness plan of the rotation site. This plan should be reviewed during the orientation process. In the event of an accidental injury or illness of any student, the rotation site will, upon request, provide emergency medical care, but will not be responsible for costs involved, follow-up care, or hospitalization in connection with the event. If an injury or illness occurs at the practice site, an emergency contact individual and information can be found under the student's profile in CORE. In addition, the Office of Experiential Education must be notified, and an incident form should be completed in CORE. In the event of a high-risk situation at the practice site or surrounding area, students may need to be excused or removed from the site until it is determined that the risk has been attenuated. In some cases, students may not be able to return to the site. The course coordinator will aim to reassign the student to another site whenever possible, but the student may have to complete the rotation at a later time. To ensure that we have the most up-to-date information on our preceptors, and so that we can support preceptors throughout student rotations, we ask that preceptors contact us if any of the situations on the screen occur, including position or site changes. Students are often surprised at the end of the rotation if they receive a failing grade and have not been given adequate feedback on areas of concern prior to the evaluation. If you have a struggling student, please make sure to document issues explicitly and notify the Office of Experiential Education immediately so that we can assist you in the next steps for managing these situations.
These slides should provide you all the information necessary to precept a student for a Patient Care Elective APPE. All general information related to APPEs can be found earlier in the presentation underneath the general guidelines. In this part of the presentation, I will explain what we hope the student will do and learn at your site, ways in which you can incorporate them into your workflow to help them achieve the goals, assignments that are required of them, and I will conclude with a suggested model for the rotation, looking at it week to week. There are multiple ability outcomes tied to each rotation classification. An ability outcome is a clear statement explaining what students can do as a result of instruction. Under each ability outcome, there are rotation objectives that define what knowledge, skills, and attitudes the students should demonstrate as part of that outcome. For problem solving, the overarching outcome is that the student pharmacist collects information to identify patients' needs, assesses information, creates a plan, and monitors care of a patient. Examples of the rotation objectives are that the student evaluate drug regimens for appropriateness, safety, and effectiveness, develop a plan for pharmacotherapy, monitor for drug and disease effects, and identify medication safety issues. Skills they will need are collecting subjective and objective information from medical records and patients, performing physical assessment as appropriate, and utilizing technology to deliver patient care. Examples of rotation activities that could be done to have the student demonstrate their problem-solving abilities and achievement of the objectives of the rotation are listed on the slide. They can include reviewing patient charts, conducting patient interviews or telemanagement calls, collecting medication histories, or performing medication reconciliation, presenting patients to the preceptor or team, and writing notes in the electronic health record, rounds, and management activities. The students will also practice this ability outcome in their case presentation, which is required on this rotation, as well as their SOAP notes or chart notes that they complete. The second ability outcome for the rotation is critical thinking, which typically goes hand in hand with problem solving. The overarching outcome for critical thinking is described as the student pharmacist evaluating data credibility, analyzing information to justify recommendations, and providing rationale for why alternative solutions were ruled out. Examples of the rotation objectives are that the student can analyze assumptions of a system or patient-related factors, and then incorporate those factors along with evidence and cost principles to support recommendations. They will also need skills in developing differential lists or prioritization, and rotation activities that could be done to have the student demonstrate this ability include several of the ones described earlier for problem solving, as well as the assignments that are options and/or required for this rotation. In order to problem solve and critically think, students must be able to integrate knowledge that they have previously learned throughout their schooling to deliver patient care. Examples of the rotation objectives are shown on the screen, and activities to demonstrate this ability could include presentations of their patients to the preceptor or the team, as well as the topic discussions or in-services that are conducted with the preceptor. Literature evaluation and being able to retrieve evidence-based information to support patient care recommendations is crucial for students on any APPE. Examples of the rotation objectives are shown on the screen, and activities to demonstrate this ability could include the day-to-day searching of drug information resources to answer questions and make recommendations, as well as two of the assignments that are options on this rotation. Written communication skills will also be assessed as part of the rotation, and the ability outcome for written communication is described as the student pharmacist documents patient care or non-patient care activities and recommendations. Examples of the rotation objectives are for the student to understand site-specific requirements for documentation, assess literacy of their audience to adjust strategies and convey messages effectively, and utilize technology to document their activities. Documentation will be a key practice opportunity to identify a student's written communication, as well as several of the optional projects for this rotation. Students should be given the opportunity to communicate with both patients and healthcare professionals on the rotation, and it is important that they understand appropriate communication techniques and utilize verbal and nonverbal communication appropriately. Opportunities to demonstrate their oral communication skills include education, counseling opportunities, providing drug information to healthcare providers, and their daily interactions with patients, caregivers, and the healthcare team, as well as several of the oral presentations as part of their optional assignments. Naturally, the student should become an integral member of the team while on rotation. Being a good team member means establishing rapport, being prepared for rounds or meetings, being proactive, working well with others, and recognizing other people's roles on the team. Since they will be interacting regularly with all members of the team, including patients and caregivers, they will need to be provided with some responsibilities to demonstrate their ability to collaborate, and practice opportunities are shown on the screen. Throughout the rotation, the student will likely be exposed to patients with different social, cultural, or religious backgrounds than themselves. Students should be respectful of these differences and understand the social determinants of health of differing populations, so they can ensure patients they are treating have access to quality care. The student's demeanor should consistently be professional, exuding confidence, trust, and respect. They need to be ethical, assume responsibility, and above all, put the patient's needs first. In order to do this, students should be exposed to situations in which this can be demonstrated and, of course, developed. Similar to valuing and ethical decision-making, the student should be exposed to situations in which their self-learning can be demonstrated and developed. Preceptors should observe the student's ability to know their strengths and areas for improvement, how they accept feedback and manage their time, and of course, their interest in learning and growing. Throughout all experiential courses, students are evaluated on their professionalism using a consistent evaluation so that behaviors can be tracked as students progress through the curriculum. This evaluation is broken into 3 categories: competency or professional capacity, connection or interpersonal compatibility, and character or personal reliability. For an in-depth look at all professionalism criteria, please refer to the manual. In addition to the day-to-day patient care activities, students are required to complete 2 assignments. 4 assignment options are available on your slide: drug information papers, journal club, case presentation, or project. Each assignment is evaluated separately in Core ELMS, and the student is required to upload a file to demonstrate the work done for each assignment. The recommended timing during the rotation for completion of these assignments is also shown on the screen. The remaining requirements for the rotation include a minimum of 3 SOAP notes or chart notes or CMRs, whichever is most pertinent to your site. These do not need to be uploaded in Core ELMS, but must be reviewed by the preceptor. Students and preceptors must also complete a mid-evaluation, a final evaluation, and an evaluation for each of the 2 submitted assignments. As a preceptor, you should ensure that all requirements are uploaded and completed before assigning the student their final grade. The weighting of a student's grade is broken down to 60% coming from day-to-day performance, 20% for professionalism, and 20% for assignments. Recall that they do 2 assignments, therefore each assignment is worth 10%. The overall rating scale for each evaluation ranges from unacceptable to proficient. This 4-point Likert scale has descriptors for each criteria that are provided within the evaluation. In order to successfully complete the rotation, the student must receive a 70% on each of the sections of the evaluation, as well as each assignment. If any unacceptable is scored for the student criteria, this will trigger an automatic failure for the rotation. It may be helpful to think about the student in terms of incorporating them into your workflow over the course of the rotation. During week 1, the student will spend a lot of time getting used to the electronic health record, documentation at your site, you, and the process. A lot of orientation will be required the first couple days. The first week, the student can usually handle 1 to 2 patients to follow and can begin thinking about the projects and assignments for the rotation. The second week, the student can likely handle following more patients and begin working on mutually agreed upon projects. Weeks 3 and 4, the student can begin making approved recommendations, supervised, to patients and healthcare providers. They can also do additional pertinent tasks as part of your role in the patient care setting. Depending on your level of comfort with the student and where they are in their development, students can often perform many of these responsibilities independently by week 5 and can carry on several patients to follow. You can vary due dates for assignments such that not all of them are due the last week so that you can provide feedback throughout the rotation. If you have any additional questions on how to engage your student on this patient care elective, you are welcome to search the APPE manual for more detailed information, or you may contact the Experiential office and you will be directed to your coordinator.
We'll now spend a few minutes reviewing our experiential learning management system called Core ELMS. We'll be using Core ELMS for many different things, including for you as a preceptor to market yourself to students, maintaining your profile, your syllabus, etc. For student assessments, to review evaluations and assignments. For student issues, to report absences or incidents, and a lot more we'll go over today. Remember that our website is corehighered.com/SSO/STLCOP. That stands for single sign-on, and it's important to bookmark one of those sites because if you use Google to search Core ELMS, you'll get to Core site, but not to the specific St. Louis College of Pharmacy Core site. As far as your username, please remember it's going to be your username at stlcop.edu. For me, it's ngaddis@stlcop.edu, and for others, it might be your full first name, like nicole.gaddis@stlcop.edu. The password was originally sent in your welcome packet, and if you need a new one, you can call our St. Louis College of Pharmacy IT Help Desk at 314-367-8700, extension 5555. If you're having trouble signing in, you can try and sign in incognito mode or in private browsing, depending on the web browser you're using, and that's especially true if you're using Office 365. Read messages from the Office of Experiential Education will be saved in the Message Center on Core ELMS, but the emails will be coming from no-reply@corehighered.com. So if you can add that email to your trusted email sources or check your spam folder if you're not getting our emails, it might be helpful. Students can see your photo if you add it by clicking the camera icon next to your name, which is pretty neat. At least once a year, or anytime you have a change, go into the My Account setting to update your contact information. As you scroll down, make sure you see the custom fields. This will ask some additional questions related to your site that students can use to review your site, and also we may use for accreditation. For example, how many prescriptions you fill a day, number of beds in your health system, interprofessional interactions, and other items like that. It also contains a list of activities that students may complete at your site. Remember, if you do have an address change, it will require immediate notification if you have a current student, as we are required to get all new addresses approved by our Missouri Board of Pharmacy. So you can update on Core ELMS, but if you have that student coming up soon or right away, let your coordinator know. If you keep scrolling to the bottom of that My Account section, you're going to see this login information, but because we use a single sign-on, all the login information is controlled by St. Louis College of Pharmacy's IT Help Desk, so please don't change any of the information you see in this section. Next, go to the profile information on the left-hand side of the screen. Here you're going to add a description of the rotation, which is nice because you can use bolding and other formatting. You can let students know if there's housing available and your website. Next, you're going to be looking at what specialties that you can attach to your rotation. These are searchable by students, and mostly if you have a specialty site such as oncology, you'd want to make sure that that's chosen. You want to contact your coordinator to request a change or an update to your specialties. There's a document section where you can add your syllabus or other documents like maps or pre-work you want students to complete before they come to the site. There's a profile. You can click this button to see what students will see when they are looking at your profile. So every fall on Core, first thing we're going to be submitting availability. To do this, we want to first go to Scheduling, then Submit Availability, and you'll see each rotation module that you have options for, and you'll pick what type of rotation, as well as the number of students. You can enter in 0, 1, or 2 students for each of those modules. Ignore any dupe buttons that you see on the page. Next, you can give us a limit for the year. Please do note that this is not a limit per rotation, but a limit for the entire date range, if you'd like to add that in. And you can also make notes for our office. Also remember that we have a maximum of 2 students per rotation, per preceptor simultaneously, and that's for any rotation type or from any school. So if you take both IPPEs and APPEs, you'll need to be cognizant of not entering 2 IPPEs and 2 APPEs at the same time. Also, make sure you click at the bottom, Update Availability for Group. We heard about a couple people not clicking this and then we weren't getting their availability. Each fall, we ask preceptors to electronically sign our experiential education terms and conditions. Please read the acknowledgement, but you'll be attesting to things such as you're in good license standing, you accept responsibility for creating a positive learning environment for the students, you'll provide timely feedback, and meet our expectations, among other things. So to get here, you're going to go under My Requirements, and you'll see Experiential Education Terms and Conditions, and you'll click there. Every spring, you'll get your rotation schedule. So to view your already scheduled students, you'll be going to Rotation Schedule, and then you'll be able to see all of your students. So this is what it may look like. If you click P4 Test Student, if that was their name, it would come up with the email for that student, but there's no other contact information available from this screen. So let's look at that next. To get the student contact information, you'll want to be on the home screen, which is here. You can click Home. Then on the middle, you can click Select Student from your schedule. It'll look like this, and you can pick the student you'd like, and you'll see their contact here. You'll also be able to pull up their phone numbers, their cell phone numbers, as well as a quick link to their evaluations and their CV. We will now look at the students' assignments and evaluations on the platform. Over here on the left, you'll see a spot that says Field Encounters. Think of this as their assignments. So you can filter by your student as well as your rotation type. You'll see this student has uploaded various interventions as well as assignments. If they've attached an assignment, you'll see it here in blue. For example, the student has uploaded their reflection assignment as well as their case presentation. Additionally, this is where we ask students to upload every patient intervention that they complete while on your rotation. An intervention is when they make a change in a patient's therapy or health. For example, they had changed a dose, gave a vaccine, or answered a DI question. Generally, students have between 25 and 100 interventions while on rotation. When you're ready to evaluate students, come back home and choose your student here. If you went through evaluations, you'll actually see a very long list of all the evals for all the students for the year. So we recommend using this home button for ease. Home, pick your student, and scroll down. For this P3 test student, these are the evaluations I need to fill out for this student. On this page is also where you'll find their information as well as their curriculum vitae. Depending on your rotation type, you'll see the evaluations you need to fill out. For ambulatory care, we have to do 2 assignments, journal club, drug information, or case presentation, and I would only fill out the 2 assignments that the student completed. About midway through the rotation, 2.5 weeks in, we would come here and choose the ambulatory care performance evaluation. This is the same evaluation that will be filled out at the end of the rotation as well. We recommend that you have the students fill this out first, because if they do so, you'll be able to see how the student has assigned themselves in their self-evaluation, as well as any comments that they made about this areas. So right here, the student had said, I need to review diabetes medication. Then you'll be able to assess them yourself and then add any comments that might be important to respond to the student comments or to add your own. After it's done for mid-mod, there'll be an M next to the evaluation, and you'll be able to complete it again as a final evaluation, including keeping your comments from the mid-mod. One note, the reflection grade is within the performance evaluation, if your rotation has a reflection assigned to it. After you've done all the evaluations, you can come up to the final grade. This will pull in the grades from the 2 assignments. They'll be pre-populated here if they're already graded. And then it will have you submit the score to submit the final grade to us. Here are some items you may do with each student as needed or required. The absence policy is located in our Experiential Education Guidelines in the Rotations Manual. As a reminder, time missed, including excused absences, is subject to be made up. If the student is ill or has an emergency, the student should notify the preceptor immediately and document it on Core ELMS as soon as possible. This will be under absences on the left-hand side. Generally, the students will be submitting their absence themselves, including the date, the reasons, and any comments. The preceptors will then go in and approve the pending request. One of you would also need to indicate how the time is going to be made up. If there are issues with students having internet access or the student is not able to report it, preceptors can go in and add new themselves. In this case, just let the student know that you did it to avoid double entering. And if students are unexpectedly missing and you don't have any contact from them, please do contact our office as soon as possible and we'll assist. We also have an area to report incidents, along the left-hand side underneath absences. You can hit Record New Incident. So what exactly is an incident? There are 4 types listed here: behavioral concerns, injury, illness, and exposure, policy or code violation, or other, and then you specify for us. You'll be able to see your previously submitted incidences on this page as well. Please fill out the form as completely as you can, and this form will remain confidential between you, our office, and appropriate personnel at the college. You may also upload files if they're applicable as well. And we have a document library below that. That's where you can review documents such as our rotation manual, which includes our syllabus, our assignment criteria, the guidelines, etc. If you want a document to be placed here, let us know and we might be able to add it. We realize there are a lot of changes with new curriculum as well as the new experiential learning management system. We welcome feedback on any component for our rotations. Please don't hesitate to contact our office or your coordinator with feedback or questions. Thanks so much for watching. To assure we know you completed this training, on CEI, click on the Exam tab and complete the 2 attestation questions. Thanks. Have a great day.